Hello, this is Sheila Harrison coming to you from the EBC meetup for October. Today we're featuring Travis Middleton, who is with Trademark Insurance Agency, and he's going to talk to us about the new Obamacare rollout and whether it's going to be a train wreck or an express train for you and your company. We have these meetups every month and we invite you to join us. This will be a continuing series as this program rolls out and it can affect your business. We want to help you. Come join us next month.
Thank you all for being here. I'm Travis Middleton, the manager for Trademark Insurance Agency. We've been in business for 37 years. We started out handling small to mid-sized groups in the U.S. market, and we've progressed from there, repositioning our company to also handle international companies that are either coming into the U.S. market to work or sending employees outbound to work internationally. The Affordable Care Act has been on everyone's mind as we move forward to January the 1st of 2014. And so what I brought to you is an overview of a little bit of historical perspective of the U.S. To healthcare, and then also what you can expect. I did these slides about 2 weeks ago, and I've noticed in reviewing them this morning, they're already out of date. Plus there's a couple of slides that you'll be looking at that also have had rules and regulations issued by the IRS, which will, as we get to those particular pieces in the presentation, I'll point out to you, which have changed also. If you're a small group person, and small group being 2 to 50, you're not having to provide health insurance for your employees under the Affordable Care Act. But you're still subject to a lot of the nuance of the Affordable Care Act. And one of the ones that bothers me on a regular basis is we do a lot of husband and wife companies. We do a lot of two-person entrepreneurs. And part of the Affordable Care Act says that husband and wife can no longer be a two-person group. Why? I have no idea. But you will not be able to go out and get a group product now for a husband and wife in 2014, and especially then again in 2015. You can have a husband and wife, but you have to have a third employee. If you have to have a third employee that's on your wage and tax report, you can write it at that point. So it's these types of nuance and rules and regulations that are coming in where you need to fall back on the person who's been doing the studying, your professional insurance agent, your CPA, someone that you have trust and faith in who has read been to the classes, read the rules, is trying very hard to understand what's exactly going on. So as we move forward, what we're going to see is a brief history. Theodore Roosevelt actually was the first president of the U.S. to suggest a nationalized health care plan in the United States during his presidency. So that's how far back this goes. People like Dwight Eisenhower even had thoughts on having nationalized health care. So the way that this has been structured, especially since the Clintons in the early 90s during their presidency, you heard about Hillary Care. This has really expanded to the point that this was forced upon the nation when one party had full control of both the presidency and the Congress, both the Senate and the House. There were no Republicans that voted for it. Even though we were in, and I've done a lot of grassroots lobbying, even though we were in Washington, D.C. and working with our local legislators on a regular basis, very often we were simply just dismissed as insurance agents. In fact, I've had a local representative here that after the Affordable Care Act was passed simply looked at me and said, well, I almost got rid of you guys. So as a result, there's a frustration level from the agent standpoint, because we are the ones who are spending the majority of the time learning about what's in the rules and regulations and how to position your company. And that's part of what we'll go through as we're doing this presentation, is to show you what's being said inside and then also interpret it so that you can set a strategy for your company on how to stay with your group health insurance, replace your group health insurance, or simply set a strategy for how you move forward as further rules and regulations apply. The Affordable Care Act is, of course, known as Obamacare. It was also the Patient Provider Affordable Care Act, and now it's just simply called the Affordable Care Act. Was originally designed to promote wellness and illness prevention. That's why you see in the particular program a zero copay on any services that have to do with wellness. So whether you're a lady going in for your gynecologist or breast exams, whether you're a gentleman going in for colonoscopy or prostate exams, these are all considered to be wellness. Those are types that would be scheduled through the American Medical Association in conjunction with the federal government, saying these are the time periods that you would want to go have these particular tests done in. And when you're having those tests, there is no copay. So to you, it appears to be free. Of course, as business people, we all know that we pay our taxes, and those taxes are actually what are now covering, plus our premiums are now what are covering these free services we're obtaining. The ACA is supposed to improve the healthcare system itself and the performance, and they're trying to do that through several different stair steps, and one of them being health information technology. They're trying to get all the hospitals and doctors onto a particular software piece so that they can do mega data out of my realm of expertise, such as Google would do, to incorporate best care practices that can then be shared with other doctors in a different area of the country or the world on what was successful and what was the least intrusive in providing that type of care for you. Supposed to be curbing rising health care costs. That remains to be seen. We've seen what happens with Medicare and Medicaid and CHIP, and we will just have to wait and see if the Affordable Care Act will really do that particular piece or not. And to be honest and not political about it, we won't know for quite a while. It's going to take a while for those pieces to come in. There's three critical elements to this: a guaranteed issue. Previously, if you had an individual policy, you would have to go through a medical underwriting, and typically in the state of Texas, the medical underwriting is simply a application where the insurance carrier might use an overview of what prescription drugs you're taking, your medical history that you report, and possibly any information from a group called Medical Information Bureau. And they would use that to determine what your actual premium was. They would quote you a street rate and then come back to that particular premium that they were offering to you. The guaranteed issue, just about everything we'll be talking about right now is going to start January 1st of 2014. And that's where you'll see the guaranteed issue piece. And we will then see the individual mandate, which I understand has been talked about in the news quite often right now. The individual mandate simply says that every U.S. citizen that does not have coverage somewhere has to go purchase coverage. And once you have said that, then you start saying, okay, the people that are below 100% of poverty at that point will qualify for several of the additional methods of financing their health care, which we were already doing. In the state of Texas, the state of Texas opted out of Medicaid expansion, and so as a result, a number of the people that are below the 100% poverty line aren't covered through the Affordable Care Act in the state of Texas. From 100% to 400% of the poverty level, you will have a sliding scale subsidy, which will then reimburse you for the particular plan that you were to purchase through the federal exchange. The federal exchange is also known as the federal marketplace. The federal marketplace, when it's up and running appropriately, should allow you to go in, fill out your application, allow you to shop for the different plans that are available to you, select the one that best fits your needs, and then apply your subsidy to that so that you have a net premium that you're going to owe. From everything that we've seen so far, even the most inexpensive, the least expensive plan with the big subsidy someone's still going to be paying around 2% of that premium themselves, personally themselves, for that particular plan. As an agent who's been doing this for 37 years, I'm very interested in seeing how that really does play out, though, because we have never seen, when someone didn't want the insurance at any cost, then they just didn't sign up. They used the public facilities at that point. The third critical portion of this is the subsidies. And from the subsidies, you have, as I was talking about, Medicaid and the states that are participating in that expansion. In that expansion, what happens is the federal government for the first 3 years will provide about 100% coverage, or not, I'm sorry, not 100%, they're going to be providing a major portion of that coverage for the Medicaid expansion for 3 years. After that, the state, that cost shift then will go back to the states. And the states will then have to figure out how they come up with their particular share of the expansion on Medicaid. The state of Texas, Governor Perry, decided that they were not going to expand the Medicaid product, their particular model. And our model in Texas is a little different from the rest of the U.S. Anyway, because in ours, you are Medicaid is a contractual basis with the different providers. Federal tax credits will help pay for the premiums. That's the subsidy. You also have a cost-sharing subsidy for low-income people. So anybody that's below 250% of the poverty level actually get a cost-sharing piece. Besides their subsidy, they also get a cost-sharing subsidy. The cost-sharing subsidy allows for that person not to have co-pays, deductibles, or co-insurance. So they can actually, if 250% below the 250% of the poverty level, they can actually apply for that cost-sharing and have those waived out also. All the insurance definitions remain unchanged, so the ones that you've always been aware of, deductible, co-insurance, co-pays, anything of that nature, your open enrollment will still be there also. The difference though is your open enrollment will be very similar to Medicare. The open enrollment every year will only be from October 15th to December 7th, which I think is the exact same thing the Medicare open enrollment period is, which is also known as annual. The exchanges are set up in two categories, the individuals and the shop. Individuals explain themselves very easily. The shop is the commercial side for small groups. In the shop exchange or marketplace, a small company, excuse me, a small company could actually go to that particular portion of the website, view which plans were available to them, and apply for those coverages for their employees. If the company is of a certain size, they might even be able to apply for the tax credit. The tax credit can be substantial to a small company. The problem with that tax credit, though, is it's very narrow, limited, defined for how that subsidy is actually applied. You typically are going to have less than 25 employees. Everyone has to make less than $50,000, and you have a sliding scale that works up to that number as to what your subsidy is. So in the 3 years that the subsidy has been available, the number of times we've shown it, we have never been able to place or advise a client that go to your CPA and have the subsidy applied to your account. Now there is a formula for this. I'd be glad to sit with anybody who would like to go through that. I'd be glad to provide them with a formula. I'd be glad to help them with their CPA, talk to their CPA to see if they could qualify. Because again, if you can qualify, there's a very nice subsidy, which is around 20 to 30%, going up to 50% of the premium during 2014 and 2015. The problem we've got right now with the shop piece on the exchange or marketplace is that they put off being able to access the shop marketplace until November the 1st. There's actually only one insurance carrier that has filed to have plans involved with the shop, and that's Blue Cross Blue Shield. So I really don't see the shop in 2014 being an effective piece for an awful lot of companies. There may still be some people who maybe don't have coverage. They fit that parameter of where the cost subsidies are that may actually work out. So it's something you shouldn't turn down, but you can always access the open market, private exchanges for this type of coverage. And just to back up for just a second, I keep saying exchanges are marketplace. When the bill was first passed, they were called exchanges. And the HHS decided that didn't translate too well to an awful lot of people, so they decided to change the name over to marketplace. So the exchange marketplace are interchangeable names, but the Health and Human Services is talking these days about the fact that it's a marketplace, and that's what you'll hear referred to most of the time in the news. Federal poverty level, here's just a guideline to it. So 100% of the poverty level from one person is going to be $11,490 a year in annual salary. If you had a family of four, 400% of the poverty level would take you up to $94,200.
How much?
$94,200 with a family of four. There's basically there's four ways to you to access the coverages, to view them, and to see which one would fit what you're trying to accomplish, what the prices are. Your traditional person is your agent, and will have access to, especially agents. Excuse me, I apologize for that. I've been fighting allergies for about 4 days now. Excuse me. Your insurance agent will have access both to all products in the federal marketplace and in the open marketplace, your traditional spot, just as we have right now. So they will be able to advise you. Now, most agents that I know, they're in associations such as the National Association of Health Underwriters, the National Association of Financial Agents, the Independent Insurance Agents Association. Those people will be able to direct you because they've gone through the study and mastered the modules and passed the certification course to be able to actually advise on the different policies that are available. Navigators are a new person who were set up by this legislation. And a navigator is one who cannot direct you to a particular product. They can just talk to you in broad terms about which products are available, what the coverages are, and what they can do. So as opposed to your insurance agent who would say, well, this Blue Cross Blue Shield policy, I think will work better for you because the network is in your neighborhood, as opposed to the Aetna policy, I don't think will work as good for you because it has a narrower network and it doesn't have the doctors you want into it. Then, so your navigator is limited to what they can do. And the navigator also is not someone you're going to visit with in person. Those people are going to be on the telephone or on the internet through your chat rooms. There is a third one we're not showing on here, which is also the certified enroller. The certified enroller is not a licensed agent, but they can advise you on which policy may or may not be better for you. What we have seen so far in Texas, and especially in Harris County, is we have not seen too many of the certified enrollers showing up. They haven't gone through the training classes that they need to be able to advise you on that. Still, again, the best place to be going, and I really don't understand from a national standpoint why it doesn't get talked about more, because the focus is the political fight on the fact that the website's not working. Our agency is writing individual policies on a daily basis, and we're bypassing the federal marketplace. The only thing that we can't do is advise you at this point on what your subsidy may or may not be. So we can help you find the policy you need, we can direct you to that, and you can then go apply. If you want to, you can do a paper app and send that in, if not, finalize with them on any of those methods that would be best suit you for subsidy, or whether or not you don't qualify for subsidy. The patient protection pieces are here are the pre-existing condition. As of January 1st, pre-existing condition will no longer be in play. So you've got terminal cancer on December the 30th, and you live to January the 1st, you've applied, your policy's been approved, everything is done. On January the 1st, you can go for cancer treatment that next day. The only thing you'll have then will be your co-pays, your deductibles, and your co-insurance. Previously, if you were doing that without any insurance, you were going to have to go down to Ventop or one of the public hospitals and have your treatments done there at that time. This just changes a bit of the finance, but you do have a method that will provide you possibly with a larger network of the type doctors you need for your type of medical event that's going on. Dependent children coverage age 26. This is not new to Texas. We were already covering children up to age 26. The fun one to me always is the fact that you could have a child that's not living with you who is married and working. But since they decided not to get their health insurance, or their employer didn't provide them with health insurance, they could come on their parents' plan. Not sure I understood that one, but you can't cancel a policy for any reason. The state of Texas had already had that. Most of the safeguards that we're seeing from the Patient Protection Act, we had already seen in the state of Texas. The essential health benefits. This is in the news right now over the fact that a lot of the insurance carriers are canceling policies on people in different states, Florida, California, and such. The reason those policies are being canceled is because they do not have the essential benefits that the Affordable Care Act says have to be inside of a plan. So the insurance carriers are having to switch over. It doesn't make sense for the insurance carriers to keep the old plans because there's going to be so few of them. The cost effectiveness is going to be prohibitive trying to carry those forth in 2014 or 2015. So all of the insurance carriers have taken the thought process in to start replacing those policies. There are a couple of carriers, though, who are writing policies now that will extend through December of 2014 so that you can actually see what the marketplace is really going to do and how that's going to roll out. So you do have some options if you want to go to an individual policy currently now that will help carry you forward as we see what the rollout really does, what the pricing is, and what the coverages are. Unessential health benefits that all policies have to have is prescription drugs, emergency services, laboratory, newborn. Andy, how old are you?
48.
Plan on having more babies?
You never know.
Are you planning?
No planning.
Okay, you are paying for a maternity benefit that you may never use. So, because someone else is going to need it. So they're going to collect money from you to help pay for somebody else's who should be paying for their own. So that's part of the cost factors that we see on the individual policies as they go forward. Pediatric services. This is a very strange one. Pediatric services, including oral and vision care, have to be included in individual individual health insurance plan. Blue Cross Blue Shield right now will not write. I'm sorry, I'm saying that wrong. They will write you an individual plan, but if you don't show them that you have pediatric dental coverage on a standalone plan outside of Blue Cross Blue Shield, they're going to add it into their plan and charge you for it. Doesn't matter if you have children or not. You can be 22, you don't have kids, you're going to take out an individual policy, it's going to have pediatric dental and vision in it. Types of preventative services. Really, the preventative services are pretty much what were already in place in the state of Texas. I think probably the biggest one, though, is on the evidence-based preventative services, and then also on the trial or testing services that will actually be covered at 100%. So you see advertised in the paper, do you have these type of conditions? If you'll come in, we have a new medical treatment we want to try, and we'll pay you to do that. Those weren't covered under your health insurance previously. Those are now covered under your health insurance. Again, pre-existing condition is covered. Essential benefits we talked about. No preventative services we talked about. Right to appeal, we've already had that, so that's nothing new. Summary of main provisions. Again, treatment when participating in the clinical trials we just talked about. Government assistance, which is the subsidy, and then the cost sharing piece. I'll be glad to take any questions. Also, if you would like to be, talk one-on-one, be glad to stick around and do that also. Thank you for being here. I appreciate it. I'm sorry that I'm getting to bring such a boring subject, but that's the way it really presents. Thank you all.